Well, good afternoon, and thank you for joining us. In the past week, we've reached some significant milestones in our vaccination effort here in Wisconsin. We have administered over 3 million doses of COVID-19 vaccine in our state, 3,286,594 to be precise, to over 2 million people, which means that over a third of Wisconsin residents have received at least one dose. Well over 77% of our residents age 65 and over have received at least one dose, and over 65% of them have completed their series. In total, 1,301,637 people, or 21% of Wisconsinites, have completed their vaccine series. In addition to our community-based clinics in Rock County, Racine, and La Crosse counties, we opened another community-based clinic this week in Marathon County and announced a clinic will open in Douglas County next week. Also this week, the Wisconsin Center vaccination site in Milwaukee became a federal FEMA pilot site, and the vaccination sites at Alliant Energy Center in Madison and the UW Eau Claire Zorn Arena are now receiving FEMA support. By increasing staffing and vaccine allocation, these sites will be able to administer more doses and assist us in our efforts to get vaccines in arms quickly and equitably. As a state, we are moving in the right direction. Expanded eligibility, more vaccinators on board, more shots in arms. And we continue to make progress towards our goal of community immunity. It is important to remember that our supply is still limited in comparison to demand, and that our allocation is set by the federal government. This week, we learned that while our Pfizer and Moderna supply will continue at current levels, we will receive significantly fewer Johnson & Johnson doses than originally anticipated. Wisconsin is in the same boat as every state in the nation in terms of this allocation change, and we will continue to work with our network of vaccinators to get our allocation into their hands as quickly and consistently as possible. As of Monday, all Wisconsin residents age 16 and older are eligible to receive COVID-19 vaccine. And with expanded eligibility, I want to take a moment to further explain eligibility. If you live, work, or study in Wisconsin and you are 16 or older, you are eligible for vaccine, period. Getting vaccinated is free of charge to you. Vaccinators may ask for your insurance information so that they can bill for an administration fee, but that fee cannot be passed on to you. No deductibles, no copays. And you do not need to be insured, and you do not need ID to receive the vaccine. You may be asked about ID to confirm your appointment, but you cannot be turned away if you do not have an ID. We have reinforced this information with our over 2,000 vaccinators that ID is not required and that people may not be charged for vaccine. So let me be very clear. If you are uninsured, you can get vaccinated. If you are undocumented, you can get vaccinated. If you are 16 years or older, you can get vaccinated. And please, please, please do so. The more of us who get vaccinated, the closer we get to community immunity and a safer Wisconsin. Because we need to remember that COVID-19 is still here and still spreading, and we are seeing more variant strains and more cases of those strains. Today, we are reporting another 1,046 cases of COVID-19 in Wisconsin, bringing our total number of confirmed cases of COVID-19 to 582,843. Our 7-day average is now up to 733 cases per day. and another 14 Wisconsinites have died from this virus, bringing the total number of lives lost in Wisconsin to 6,667. Our hearts go out to their loved ones, and we must recommit to stopping the spread. Yes, getting vaccinated is a key tool, and so is wearing a mask and washing your hands and physical distancing. The answer to getting through to the other side of this pandemic is not vaccine or masks, it's vaccines and masks. So with that, let me now turn it over to Dr. Ryan Westergaard, Wisconsin's Chief Medical Officer and State Epidemiologist, to talk more about what we're seeing in terms of variant strains here in Wisconsin. Dr. Westergaard.
Thank you, Deputy Secretary Williams-Ventike. In the past few weeks, our 7-day average of positive cases has been rising, and we do not want any further movement in that direction. We really must take action to interrupt the transmission of COVID-19 and to prevent cases from increasing further. Stopping the spread will also help us prevent more variant strains from emerging. The fact that we have new variant strains around is not surprising. Viruses continually replicate and evolve. And when transmission is high, there's greater opportunity to create and to spread new variant strains. Most of the new genetic variation that occurs in viruses as they evolve doesn't change their function much. But once in a while, a genetic change in the virus can make them more dangerous. For example, by making them spread from person to person more quickly and easily. The risk then is that these more dangerous strains of the virus can spread throughout the population and eventually become the predominant strain that's going around in the community. And then we're left with an epidemic that is more difficult to control than the one we had several months ago. Unfortunately, this is exactly what we're experiencing now here in Wisconsin and nationwide. The CDC has identified 5 variants of concern due to evidence of their increased transmissibility in comparison to the original virus. All 5 of these strains are currently in Wisconsin, and the proportion of the Wisconsin infections that's caused by the variants of concerns is growing week by week. Because of this, we're now starting to share more data on these variant strains on our Wisconsin DHS website. Our variant data page now breaks down the number of the different variant strains by region, and it also displays a statewide table showing the number of variant cases identified during sequencing in proportion to the number of positive tests that are sequenced. And this is because not all positive COVID-19 tests are sequenced. So showing this proportion gives a more accurate picture of the prevalence of a given strain in the region and in Wisconsin. So taken together, our increasing cases and the presence and increasing prevalence of these variant strains in our state, this means that we need to do all we can to stop the spread, to both prevent infection in ourselves and our loved ones, and to prevent further mutations of the virus. Again, the evidence shows so far that all 5 of these variants of concerns in Wisconsin are more infectious, meaning more contagious than the original virus. And when a virus is more infectious and it spreads more quickly, then increased cases can lead to strain on our healthcare system and eventually a higher number of deaths from COVID-19. So please, everyone, continue to wear a mask when you go out and when you gather indoors with others outside your household, and get vaccinated. Wearing a mask can prevent the transmission of respiratory droplets. And the more people who are vaccinated, the more difficult it is for the virus to find a new person to infect, and therefore the less likely it is to mutate. Both of these are key tools. Remember also that all 3 of the vaccines we have are very effective and very safe, and the data against the variants of concern also looks very good. None of the vaccine trials, which have been and continue to be extensive, have reported any serious safety concerns, and safety data continues to be monitored as the vaccine rollout continues. After you receive the vaccine, you may experience a few common side effects like swelling where you received the shot, a headache, or some fatigue. These symptoms are common and are caused by your immune system responding to the vaccine. Many people do not experience any side effects at all after receiving the vaccine, and this is also fine. We know that people are protected from the vaccine whether you experience these symptoms or not. I know no one enjoys getting a shot, and it might be a little uncomfortable for a short amount of time, but the result of protecting yourself, your loved ones, and your community from illness is definitely worth it. So please get vaccinated and encourage your friends and your family to as well. In your community, in your social networks, you are a trusted messenger, and sharing your willingness to get vaccinated with your loved ones, in answering honest questions about people who are hesitant or undecided can make a significant difference. We appreciate your efforts very much. We'll turn it over to the moderator for questions now. Thank you.
And thank you both. And a reminder to maintain audio quality, please remain muted until it's time to ask your question. If you're able to do so, use *6 to mute and unmute your phone. In the interest of time, to ensure everyone is able to ask a question, we ask you to limit yourself to just one question, please. And we begin today with Danny Maxwell at WKOW in Madison.
Hi, thank you for taking my question. We recently had a child care center with an outbreak linked to a variant here in Dane County. So I was curious what the plan was going forward with Wisconsin child care or daycare centers in regards to variant spread, especially since younger kids are not able to get the vaccine at this time.
Dr. Westergaard, you want to talk to that?
Yes, thank you for the question. The plan, the strategy is exactly the same. As I mentioned, the nationwide variant strains are circulating everywhere and they're increasing. So transmission of variant strains is transmission of COVID-19. And all the tools that we've put in place, all the recommendations about mask wearing and social distancing and testing for contact tracing, those are all still important. In fact, there are our only tools in those types of settings. The biggest difference with the variants now circulating is that we have to work harder. More transmissible variants are less forgiving. We can't give it 75%. We have to give it 100% effort. There's little or there's less room for error. So aside from that, we need to be aware in some ways that the stakes are higher. There's less room for error. There's less of a buffer. All of the strategies that we've been putting in place for the past year are now more important than ever to protect young people from getting infected. So the strategy is the same. We just have to do it better.
Thank you for that. Let's go now with our next question to Heather Poltrock, WSAW in Wausau. Heather at WSAW. All right, let's try to get back to Heather, and we'll go to Rob Sussman, WTAQ in Green Bay. Rob Sussman.
I'm sorry, can you hear me?
Oh, Heather, yes, we can hear you. Go ahead, and we'll go to Rob next.
I'm so sorry. Most of us have been getting vaccinated our entire lives. Can you explain why this vaccine card is so important and why no one's ever gotten them with other vaccinations?
Well, first of all, Heather, I'll tell you, some of us are old enough, we do remember getting vaccine cards. So it is a common thing that we have done with vaccines in the past. The reason many people have not received a card in more recent years is because we have centralized vaccine registries here in Wisconsin. We have the Wisconsin Immunization Registry. One of the reasons the card is very important right now is because we are in a national vaccine program and we are all following the same standards that the Centers for Disease Control has established in order to receive your vaccine. So you not only receive that card, but you receive critical information about the vaccine that you've received, and you receive information to enroll in VSafe, which is the vaccine safety and monitoring system that you can communicate directly with CDC about any symptoms or adverse events that you experience. So it's all part of a national campaign. What I would say to people, because I've heard people worried about losing the magic card, is your vaccine is also recorded in the Wisconsin Immunization Registry. And if you need a record of your vaccine, you can go to the Wisconsin Immunization Registry website, and with your name and identifying information, you can look up your own record. You can print a record. You could show that record on a phone if someone was asking for verification of your vaccine. And so there are multiple ways to show evidence that you have had a vaccine.
Wonderful, thank you. And now we have Rob Sussman at WTAQ in Green Bay.
Hi, thanks for taking my question. My question is for Dr. Westergaard. When the vaccine first started rolling out, people were talking about the potential to eradicate COVID-19 in the same way that smallpox was eradicated. With these variants popping up, is that still in the cards, or could this become an endemic virus like the flu or the common cold? Thank you. Bye-bye.
I think it's much more likely this will become an endemic virus like the influenza and seasonal coronaviruses and other respiratory viruses. But there's an important distinction that if we get high levels of immunization, in addition to preventing transmission, immunization, the COVID vaccines that we have authorized are especially good at preventing severe disease and death. So even if they are less than 100% at eliminating transmission, if we can get a high proportion of people vaccinated, we could potentially end COVID-19 epidemic as a serious threat to mortality and hospitalization. So I think that is the goal here. SARS-CoV-2 was not the first coronavirus. They've been around for probably thousands of years, and it will not be the last. And it may not be possible to completely eradicate it like we have smallpox, for example, because it's so ubiquitous. But I think a very reasonable goal is to have high enough levels of immunity that transmission is rare and severe diseases and deaths are extremely rare, because I think that's really the power that vaccines have had given the data that we've seen so far.
Thank you for that. The next question to Madeline Anderson at Fox 6 in Milwaukee.
Hi, I was just wondering if the UK variant, which is now the dominant strain in the US, if that's also the dominant strain in Wisconsin, or maybe we don't know. And then are hospitals already seeing an uptick in COVID-19 patients in Wisconsin because of the variant and just overall increase in cases? Thank you.
Sure. The first question about the UK variant, or the B117 variant, nationally it has become sort of the highest single strain that's proportionate. And yes, we're seeing the same thing in Wisconsin. Our website shows the proportion overall of all the specimens that we've sequenced, and it's a relatively small proportion of the B117 variant. But what we will be coming forth with as the data get clean and ready for presentation is how is that actually changing over time? And it's changing substantially. I expect that in the next few weeks, if not already, B117 will be the predominant strain in Wisconsin. And the trend is very clearly in that direction everywhere.
In terms of hospitalizations, we have not seen a huge surge in hospitalizations. They're up a little bit from, again, a week or two ago. As Dr. Westergaard has indicated, we're seeing a doubling of cases over the last few weeks, and we haven't yet seen a doubling of hospitalizations, but we are seeing a slight rise. Now, the important thing to remember, as we've been through many times in this pandemic, is you don't want to wait to see rises in hospitalizations to know that you have an issue. That is a lagging indicator. People do get infected and become ill and have symptoms often for several days and even weeks before they get ill enough that they need hospitalization. And so what we really need to be focused on are the testing numbers, the positivity rates, and the cases to be the factor that says to us, we need to continue to take action. And I think you hear from both of us today, this is continuing in the wrong direction, and we need to go back to the tools that we have been using throughout the pandemic, with the addition of everybody getting a vaccine now, to reverse this trend.
Thank you for that. Let's go now to Denise Lockwood at Racine County I.
Thanks for taking my call. I had a reader of mine ask this question. She asked, are we sure that the positivity rate and the number of rises, the rising case levels are not but a bunch of false positives since all of these people started getting shots? So I wanted just to kind of make sure I got a response from that.
Dr. Westergaard, do you want to talk about testing and its relationship to vaccine?
Sure, yeah, I'd be happy to. I'm glad that you asked it. First of all, the large majority of the tests that are still reported on our website are the highly sensitive molecular tests. So false positives are not unheard of, but uncommon. Another piece, some nuance, and these are data that are visible on our website if you look, is what age groups are responsible for the increase in cases. And we break that down on our website, and you can see the curve of increased, week by week, day by day, which age groups have the most cases in them. And this has not been the case throughout the pandemic. As of this week, the highest number of cases in any age group is among those under 18. So this is a real concern. On the one hand, we should feel good about the degree to which we've protected our older Wisconsin residents. So I think over 75% of Wisconsin residents over 65 have received some vaccine. So that's outstanding news. That's a high degree of protection against the increase in hospitalizations and deaths that we're concerned about. But we can't stop there. There's a very important segment of our community, meaning our kids, who are susceptible to the virus. They can become infected, they can spread it to each other, and they can spread it to vulnerable, unvaccinated adults. And if we see the epidemic heat up, we see increases in transmission among young people who are not vaccinated, because we don't yet have community immunity, as Julie had said, there are still a lot of vulnerable people who are at high risk, particularly now when children are becoming more active outside, here in Madison, they're going back to in-person school. There's more sports being done. We can't think that we're done with this. We have to be vigilant. We have to wear masks. We have to gather outdoors. We have to encourage vaccination for everyone who is eligible, because that's the consequence, is that we are not going to get to 100% vaccine coverage probably this year. And there's a danger of the epidemic getting out of control and having unnecessary severe illnesses and deaths. So the short answer I would say is no, I don't believe the numbers are artifactual from false positives. I believe there's increased transmission. And if you think it this way, compared to a month ago, our 7-day average is 100% higher, 100%, a doubling. It was 380 the week of March 10th. It is now, as you said, over 700. So this is a real trend. We are in a new phase of the epidemic that is clearly worse than we were before. And it's transmission among young people who are driving the change in the curve.
And let me just add to that and say, if you have a vaccine, it does not affect whether you would be able to detect virus in a nasal swab. So a vaccine has nothing to do with the effectiveness of the test, because if you are exposed and infected with COVID-19, it's detected in your nose for the test that we are reporting here, not in your bloodstream, which is where you would see effects of the vaccine. So just want to be really clear too. Dr. Westergaard talked about the risk of false positives, but I want to be really clear, there's no linkage between getting a vaccine and the effectiveness of the test in a nasal swab or a sputum sample.
That's absolutely true. And I may have missed that element of the question. It is impossible for a vaccine to cause a false positive test. That's pretty clear. Yeah. Thank you for clarifying that.
Thank you both for that. Let's go now to Katie Anderson, WBAY in Green Bay. Katie Anderson.
Hi, thanks for taking my question. I'm wondering if you are seeing a disparity between men and women getting vaccinated. Are you seeing more women getting vaccinated or more men getting vaccinated? And is there any plans to address that?
Hold on just a minute. So what I would say about that is the disparity between men and women is decreasing as more and more people become eligible for vaccine. So at this point in time, we have seen more women who have been vaccinated in our state, but I can tell you the difference between how many men and how many women is getting smaller and smaller. And I would attribute a fair amount of that to our early eligibility groups. Many of those groups, especially those that were associated with occupational settings, are settings where there is a higher percentage of women who are employed there. If you think about healthcare, more women than men are employed in healthcare. And if you think about education and childcare providers, again, more women than men. You think about the wide variety of healthcare providers, not only in hospitals, but who are providing care in the home as well, which was an important target of our early vaccination. So I think at this point, I would still chalk it up primarily to the way we staged vaccine. Well, and one more thing I'd say is if you look at people over age 65, women outlive men, and so there's slightly more women in that age group than men as well. So it's largely a function of our phasing, and we encourage all men and women to get the vaccine, and men, it's a challenge to you. Here, catch up to the women, and we'll all be in better shape.
Thank you for that. Now to Kent Wainscott, WISN in Milwaukee.
Hi, Julie, earlier in the call you mentioned that the supply of vaccines statewide is still limited compared to demand, but I want to ask you specifically about here in the Milwaukee area. The Wisconsin Center vaccination site has had open appointments all week, immediate availability. The city health department is putting out notices. The walk-up clinics have no lines and no wait. Healthcare systems are opening their eligibility to patients outside of their systems. So here in Milwaukee, is there a vaccine surplus? Do we have more vaccine doses available than people willing to take the shots?
No, I think what big part of what's happening in Milwaukee is you have had a big increase in vaccine. As I mentioned, the Wisconsin Center and some of those neighborhood sites are now the beneficiary of additional doses from FEMA. And so you have the great opportunity that with this additional supply, you have 3,000 first doses a day for the next 3 weeks. So what I'd say to our colleagues in Milwaukee is thanks to our federal partners, we have a significant upsurge in vaccine supply in Milwaukee, and it is only there for a limited time. This is not going to be there for weeks and weeks and months to come. they're using these additional doses for the first 3 weeks. It is Pfizer vaccine. So then the next 3 weeks, they will be giving the second doses of those vaccines. So it is an excellent opportunity for people in Milwaukee and the Milwaukee area to sign up, get your vaccine, and let's move that vaccine coverage rate up as quickly and as high as we can in the Milwaukee area. I also want to be really clear that a major focus of this effort that FEMA is sponsoring is that we get into highly socially vulnerable neighborhoods in Milwaukee, and that's why some of the vaccine is being delivered in neighborhood settings at North and South Division High School. And we really are encouraging people in the city of Milwaukee and neighborhoods that have not had as much access to vaccine, that this is really for you. And so call the City of Milwaukee Health Department or get on to vaccinate.wi.gov and register. And the friendly folks from FEMA will be there to protect you.
Thank you for that. Now to Sean Kirkby at Wisconsin Health News. Sean Kirkby.
Hi, thanks for holding this. Regarding the Johnson & Johnson decline, how much is the state slated to receive in the following weeks? And does it affect the timeline for when there will be enough supply to reach that 80% threshold? Thank you.
Yeah, Sean, thank you for that question. One of the things the federal government keeps emphasizing with us, their state partners, is that they have always said that Johnson & Johnson supply was going to fluctuate as they stood up their manufacturing process here in the early days. And I think, you know, if we think back to December and January, we had some of those same fluctuations with Pfizer and Moderna as they began. And now the good news is Pfizer and Moderna are just a little bit more mature in this process, and we're seeing very steady rates of that vaccine. So what's happened is we've had a little bit of a roller coaster. You know, the first week or second week of March, we got a big dose of Johnson & Johnson, about 48,000 doses. The next few weeks, we had very small amounts, only a few thousand doses each week. Then again, last week, we got a big influx of Johnson & Johnson again. We got 85,000 doses of J&J last week. This week, we're down to 10,000 doses, and next week, it may be even lower than that. But what we have heard in terms of will we have enough to get to the anticipated goals that we've discussed previously, the federal government continues to assure us that J&J assures them that they will have the promised 100 million doses delivered by the end of May. So what I anticipate is we'll have a few weeks of famine and then we're going to have big feasts of Johnson & Johnson vaccine as we head into the month of May. And so it'd be easier, to be frank, if it was a really steady supply and we could assure all of our vaccinators, here's what it's going to be week by week. I am confident we will get there as manufacturing settles out on this. But right now, I just have to, again, give a big shout out to all of our vaccinators out there who are handling different amounts of vaccine from week to week.
Thank you for that. The next question goes to Scott Bauer at the Associated Press.
Hi, thanks for doing this. Julie and Dr. Westergaard too, or whoever wants to address, you know, it seems like there continues to be this kind of good news, bad news duality going on here. Good news on the vaccine front, bad news on the variants and the uptick in cases. On the whole, are you both comfortable with the continued relaxing of capacity limits and other safeguards that have been in place for months that's going on, you know, in local municipalities and nationwide? Do you feel like maybe given what you're seeing on the new cases front, does that warrant maybe slowing that down, or does the good news on the vaccine front merit loosening those restrictions?
Well, I'll make one comment, and then I welcome comments from my colleague. I would say, and as I have said throughout this, we are not ready to go back to life pre-COVID, right? We continue to, as you've heard both of us say, when we are together, we need to continue to wear masks. We need to continue to social distance. We are not ready for huge mass gatherings yet, and we need to be cautious as we move forward. I want to be really clear that there may not be a statewide mask mandate anymore, but that doesn't decrease one iota the need for everybody to behave as if there is a state mask mandate. The worst thing in the world we can do right now is say, no mandate, no mask, because we are, as has been said here, seeing spread of variants, and we need to use the mechanisms we have in place to prevent spread. So Dr. Westergaard, what would you add to that?
I'm very uncomfortable with the idea of loosening anything, with the exception of the guidance we've received from CDC about limited indoor gatherings among fully vaccinated people in households. I don't think we should be changing anything. I think the idea that because the mask mandate has been taken away, that we should stop asking our people in our community or our businesses, or particularly our schools, to not wear masks or to not encourage it would be a grave mistake. We should continue to wear masks until we're at a point when we have community level immunity and we know that we're safe, and we're not safe now.
Thank you for that. Let's go now to David Welberg at the Wisconsin State Journal.
Yeah, thank you. Dr. Westergaard, you hinted that some trend data may be coming on the variance percentages, but currently it's 1.6% of sample sequence that were the B117 and about 2.3% for the quote unquote California variants. Can you say what those percentages might have been last week or a more recent period? And then also, given that these percentages for the regions are based on how many samples are sent in for sequencing, what are we to make of the different levels, given that, say, North Central might be higher than South Central, even though the number of cases in North Central is lower?
I am not able to give you a precise percentage from last week. I'm hoping as we build data systems and more accurate reporting, we will be able to do that week by week. Right now at the national level, the CDC has shown, I think in 2 to 4 week increments, the proportion of the strains. That's something that I think we will be able to do, but we have not built that yet. So I think it's an important point. What you're seeing on our website that is new today is the overall since April of 2020. So that is a misleadingly low number, although it's accurate. That is the total proportion. The proportion of in the past 2 weeks, it's much more likely that if you take all, in fact, I know this is true. I just can't share precise numbers because of some delay in getting the data and validating the data. But it is the majority of cases that are sequenced that are one of the 5 variants. So it is quite a step, and that is consistent with what the CDC with national data has shown over the past several weeks as an expansion of the proportion of variants of concern. So we're seeing that in Wisconsin. I think a general rule of thumb that I'm comfortable sharing is that half or more are one of the 5 variants. And I hope as the data systems improve and we can validate the data for public consumption, that's something that we can share with greater specificity. And the idea of how much to read into regional differences, it's challenging. There probably is regional variation, but the relatively small proportion of positive tests that gets sequenced is probably insufficient for us to have a lot of confidence that North Central truly has more B117, for example, than the Southwest region. It's likely that they may, and I think for the sake of transparency in our ongoing learning and understanding of this, it makes sense to show where are we sequencing positive tests and what is it showing, but I think we should stop short of saying we have with statistical precision or certainty that these are true variations, because as you've mentioned, it's a small sample of overall tests, and there's plenty of variation in sampling errors. So.
All right, thank you. We go now to Stephanie Hoff at WisPolitics. Stephanie Hoff.
Just a follow-up to that, how small is the sample of tests? Is there like what percentage of positive tests are sequenced?
Yeah, it varies somewhat week to week, but I think we've been around 5% or so. I think the goal will be between 5 and 10%. There's some more labs that are coming online. I will say that 100% of the tests that get the diagnostic tests that get performed at our state lab in Madison are sent for sequencing. And 100% of the specimens that test positive through our partners at Exact Science are also sent to the state lab and available for sequencing. So we have and that includes specimens that are tested through National Guard testing sites around the state. So we have a good mechanism for sampling. What the proportion gets sampled is going to change on how many cases we have. Our laboratory infrastructure is somewhat fixed. If we have a lot more cases, and like we said, we've had a doubling in cases over the past month, then our proportion that we sequence to get that additional perspective of the genetic epidemiology is going to be lower. So the better we do preventing cases, the more intelligence we'll have about the genetic variation. But our goal is between 5 and 10%, and we're doing pretty well there.
Thank you. Next question now to Brittany Slaughter, WAOW in Wausau.
Hi, thank you. So you said that the variants are kind of the reason that we've seen such a rise in COVID cases, but where is the rise in all of these variants coming from? Where are those coming from? Thank you.
Well, the rise, so I think it's important to understand that it's the same virus. It's a rise in variant COVID-19 is the rise in COVID-19. It's just that we're taking the next layer of investigation to look at the genetic material in the specimens. So they're all the same species of virus. They all cause the same clinical illness. But adding this other perspective of the genetic, of the sequence data, it can allow us to track how certain pockets, certain clusters might grow and change and evolve and spread into different geographic areas over time. So that's really what we're able to do here. The first variant that people became familiar with was the B117 that was first in the United Kingdom. And by doing that sequencing, we've been able to see how it spread very quickly in the UK, and then gradually seeded other outbreaks all around the globe, and now is becoming the dominant strain. So I would say that one of the factors that's making our cases our number of cases increase is the fact that the strains of the virus are more transmissible. That may not be the only factor. I think we have to say that we have some control over this. And if we really worked hard on prevention, on mask wearing, on restricting gatherings, we could turn the corner again. So it's not all the fault of the variants. There's a lot of things that we can do as well.
And we'll give the next question to Eric Gunn at the Wisconsin Examiner.
Hi, thank you for taking this. You have constantly and consistently emphasized the importance of masking and distancing and avoiding gatherings, and you've done that again today, and it's certainly quite understandable. And pointed out that even with the absence of a statewide order, that there is still the need to act like there is one in place. But is there something that either you or local health officers or both are able to do that can maybe change things up and drive home the importance now of buckling down on these personal mitigation efforts so that the numbers will be able to start turning around again? Thank you.
Well, I welcome any suggestions. I think, let's be frank, we know people have pandemic fatigue and are ready to be done with this, but let's also be frank that we don't want to be done with this with hundreds and hundreds of more of our fellow friends and family having lost their lives if we don't fail to keep at it for a bit more time. And what we're doing is racing against the variants with the vaccine. So what I would say is that everyone bring one. If you're going to get vaccinated, bring a family member or talk to a family member. Talk to your friends and your family members about your own vaccine experience, how you got an appointment, how you went, how you felt, what you did to deal with your side effects, how you scheduled your vaccine so that you might not have to go to work the next day if you are going to have side effects, and how we can all support each other in getting our vaccine, because our vaccine is what will help us start to tamp down the variants in the long run. In the short run, while we do not all have vaccine, we have to keep doing the behaviors that Dr. Westergaard and I have been speaking to here. So this is not an indicator that vaccine isn't working. It's an indicator that we have to keep patience while we continue to build those vaccine levels. So Dr. Westergaard, I don't know what else you might add.
We're doing what we can. We're here talking with you. I think the other idea, we can engage you, our dear colleagues in the media, is that these stories need to be told and communicated. And when what behavioral scientists tell us about what determines whether someone does a simple behavior like wearing a mask, it's a function of a few things, but probably the most important one are a sense of social norms. Other people like me and people who are important to me are wearing a mask. I'm more likely to wear a mask. So our colleagues in the media and influencers who have the respect of others can do probably much better than Julie and I can at convincing people to change their behavior. There are trusted sources, there are thought leaders, there are influencers all throughout our community that if we could engage them to say that this should be the normal, this is how we keep each other safe, I think that could go a long way. The reason, and there's research that mask mandates work, right? They don't work because people are afraid of being sanctioned or punished for not wearing a mask. They work because they create a sense of a social norm. They say, this is what our community has decided to do. We're going to protect each other when we go into indoor areas. So a mandate sends that message to Wisconsin. Say, Wisconsin, this is what we do because we are Wisconsin, right? It's not because people are afraid of getting a ticket. So the more we can communicate, the more we can spread the word, the more we can engage thought leaders and opinion leaders to make these things normal and respected activities, I think the better off we'll be. And I think you all who are in the media can do this as well, if not better than we can. So interview and write stories about leaders who share this perspective and want to share this message. I think it would do a lot of good.
Thank you. Let's go now to Michelle Melby, Fox 11 in Green Bay. Michelle at Fox 11 in Green Bay. All right, why don't we move on to Mary Spicuzza, Milwaukee Journal Sentinel.
Thanks so much for doing this call. We wanted to check back about the variants that you're seeing among school children. We've seen reports from our neighbors, Michigan and Minnesota, especially about spread among children and youth sports. Do you have any additional information on the variants that you're seeing in terms of how many cases you're seeing among children? And are you seeing outbreaks like the one we saw in Dane County and in our neighboring states at other facilities?
Yeah, we don't have those data with the level of specificity that you're asking about. For example, when the sequence data of meaning what variant is posted publicly, it's not attached to an age or a county level. So we don't drill down to that level. And certain outbreaks, like the one that you referenced, might have a proportion of the cases sequenced, and there we might know, but we don't know systematically by age group what are the variants. We may, again, as data systems and as laboratory capacity increases that data, we may have that down the road. But right now, I think a safe way to look about it, as I mentioned, about 50% of the sequences that we are able to do are one of the variants. So there's a good chance that any given outbreak, 50-50, probably a little higher, is related to one of the variants. And so it may be safe to assume that we are all at risk for variants of the virus that are more transmissible than the one we were dealing with 6 months ago. So I think it's a safe assumption to say these are here now. This is our new pandemic, is one where we have to work even harder to prevent infection because the virus is more infectious.
Thank you. Let's give the next question now to Sarah McGrew, TMJ4 in Milwaukee. Sarah at TMJ4, *6, will mute or unmute your phone. All right, why don't we try to move on to Emily Fannin, CBS 58. Emily Fannin.
Hi there, this is Sharon Bajenda. I'm stepping in for Emily Fannin. Thank you so much for taking my question. Are we seeing a significant increase in cases in children under 18, and are there disparities in child cases with certain population groups? Also, any advice for children that do have underlying medical conditions? Thank you.
So yes, and yes, I believe our answers to both of those questions. So we're seeing a proportion of the cases that we're seeing this month compared to previous months are children under 18. That the proportions of overall cases, that there's color-coded curves on our data website if you care to look at that. Including regarding the disparities, we don't have the sort of the cross match, the stratification by those, but in general, over time, we have seen significant racial and ethnic disparities in cases, particularly severe cases. And one really concerning statistic that we now also have able to be viewed on our website is of the multi-system inflammatory syndrome in children, MISC. We've seen 88 cases of this very severe illness among Wisconsin children, and the disparities between Black and Latino children is, compared to white children, is quite dramatic. I think among Black or African American children, it's about 7 times higher than it has been reported among white children. So yes, substantial racial ethnic disparities that are really troubling.
Thank you for that. Let's go now to Marissa Wojcik, PBS Wisconsin.
Hi, thank you for taking my call. I spoke with someone yesterday who got their first shot of the Pfizer vaccine roughly 3 weeks ago, and she scheduled to have her second shot. When she showed up, they said they didn't have any of the Pfizer vaccine left. And when she tried to call a different facility, they said they couldn't give her the second dose of the vaccine because she didn't get her first dose there. Have you heard of this happening, and how common is it, and what advice are you giving to people? Thank you.
Yeah, it is not common. The place where she received her first dose should have a second dose for her because we send the second doses 3 weeks later. But we have heard this happen. I would encourage her to call our vaccination line, and we will assist her with finding an appointment. And if I keep talking while I look the number up, which I should have right in front of me, but I don't, that number is 844-684-1064. If she happens to be in the Milwaukee area, we've talked about the Wisconsin Center, and I know they are giving Pfizer, and that, and they would have appointments. But if she calls our number, we will work with her to find a provider that will have a dose for her. The other thing I want to be really clear about is while the studies were based on vaccination period 21 days apart for Pfizer, there is leniency in the number of days people can get that second dose anytime up to 42 days. I wouldn't dawdle about it because we want you to have that second dose and have that protection, but definitely give us a call and we will help work with anyone who is running into those kinds of issues.
Thank you for that. Next question to Jennifer Huang, Wisconsin Public Radio. Jennifer, Wisconsin Public Radio.
Hi, can you hear me?
Yes, we can hear you. Go ahead.
Okay. So my question is, how many vaccines is the state allocating for county jail inmates in Wisconsin, and how many vaccines have been administered to jail inmates so far?
So our vaccine allocation is done by a survey every week, and so that will depend on each county and what they are requesting and where they are directing their vaccine supply. I cannot tell you how many vaccines were given at county jails because we're not tracking that level of specificity about where vaccines are given. What I can tell you is we certainly have provided vaccines to counties who have requested vaccine for people in their correctional settings, as well as we have provided vaccines through the state correctional system.
Thank you for that. Now let's go to Alejandra Palacios, WDIO in Minnesota. Alejandra. WDIO. All right, why don't we try to go back to Michelle at Fox 11. Michelle at Fox 11. Or Sarah at TMJ4. TMJ4, are you on the call? All right, well, with that, we will wrap up today's briefing. We want to thank Deputy Secretary Julie Willems Van Dyke. We want to thank Dr. Westergaard and, of course, all of you for participating. We ask you to continue to monitor the DHS COVID-19 web pages for data and guidance, and additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.